Westbrook Health Services has been supporting the surrounding community since 1949 and is known as an agency that is community-focused, people-driven. As one of West Virginia's 13 comprehensive behavioral health centers, Westbrook provides services to 8 counties throughout the Mountaineer State and became one of the first comprehensive community behavioral health clinics in West Virginia in 2020. This podcast wouldn't be possible without the generous help of the Sisters Health Foundation. This year marks 25 years since the foundation awarded its first grant, and we couldn't be more grateful for their support. Welcome to Studio 2121.
Hello, and welcome to Studio 2121 podcast, and I am Kevin Trippett, CEO of Westbrook, and joining with me today is Mark Drennan, who is the Executive Director of the West Virginia Behavioral Provider Health Association. Mouthful.
Yes, it is.
Yeah. We are recording our 8th podcast. So for those of you that have enjoyed our podcast so far, please like the podcast. Give us a rating. Please don't hesitate to give us some feedback so we can try to make these better. And if you subscribe to them, then when we release the new ones, then you'll automatically get a notification of that. So we thank all of you that have listened so far, and please tell your friends about it so we can get the word out. We think mental health is an important topic to talk about, and the more we talk about it, the better we are with reducing stigma. So thank you very much for listening. So Mark, I mentioned that you're with the West Virginia Behavioral Health Providers Association. Can you tell us a little bit about the association?
Sure. So the West Virginia Behavioral Healthcare Providers Association, which is a mouthful, it's an association of behavioral health providers across the state of West Virginia, and we have roughly about 25 members. We're growing every day. We're almost getting close to 29, give or take. But so it was founded in about 1983. Originally, sort of a association of the 13 comprehensive community mental health centers in West Virginia.
Which were one of those.
Which Westbrook is one of those. And one of our largest ones is just serve 8 counties, right? Mm-hmm. So, and then we've expanded to other licensed behavioral health providers. So we have a few requirements. They have to have at least 25 full-time equivalent staff. They have to be a licensed behavioral health center or a licensed behavioral health hospital, and they have to be a West Virginia Medicaid provider. And so we provide a range of services for those members, including government relations and lobbying. And we have a network of committees that meet on a monthly basis, and then we meet together monthly as a full association where we bring in representatives from state government and legislature and different things.
Yeah, I find the association extremely valuable for us. I think it's great having that network of peers. I know starting off for me, when I first got to be the CFO at Westbrook, it was awesome for me to be able to reach out to CFOs at other centers and get some advice and how to do things, and then from there we got together and worked on how do we allocate funding. I mean, the state let us help them with the funding formula so that we felt like it was a fair and equitable way of doing that, and without the association that wouldn't have been possible. So
I think that's one of the hidden benefits or the relationships that have been built. And what I've seen is regionally people getting together, like-minded folks that get together to better serve individuals with behavioral health needs across West Virginia. And I think we've done a really good job, the association, as far as building relationships with our state partners that provide a lot of the funding for some of the efforts that we're rolling out now around substance abuse and residential services for those people in need.
Yeah, and with some of the work that you've done and some of the members, it seems like we're getting some more interest in
Right.
individuals wanting to join. So we had a discussion yesterday about that, and so we're going to come up with a more formal application process that makes sure that they hit all the requirements, plus try to learn what their interest is in being with the association. So we'll be rolling that out soon. So that's pretty exciting.
One of the things too I'll say is that I always think we focus on 3 different disability groups too.
Right.
So we have individuals that provide mental health services. We have members that provide substance abuse services for intellectual and developmental disabilities, children's mental health services, and some people provide all of those. And so it's a wide variety of individuals, but it seems to work pretty well together.
Yep, definitely. So one of the highlights that with the association, is it 8 years running now?
8th annual conference, right?
Yeah, so you were charged with putting a conference together, and it's been a valuable tool for me. You bring in a lot of good guest speakers. Again, sometimes even members of the association themselves become the speakers on different topics. So that's been a lot of fun, and we just finished one.
Right.
Yeah.
Yeah, we were up at Stonewall Resort, and they do a good job taking care of us and making it an affordable package for us, and we really don't have to, we kind of set that part of it and forget about it. And then we bring in speakers from all across the country. We bring in local folks from West Virginia, but we also go outside of West Virginia and bring people in. We got to bring back this year a good friend of ours, Mike Vini, who came to our first annual conference, and he's an individual that has mental health conditions, and he deals with those through drumming, and he learned that at a young age, and so he's a professional drummer, and he came and talked to us about his life story, and then we did some drumming, which was really interesting. And then we actually brought an actress who was a child actress for a number of years, and then she stepped away from that, and now she does mental health speaking engagements, and then how she takes care of herself. It's been tough with COVID over the last few years. Individuals in healthcare and in behavioral health, we haven't stopped the whole time. We've just had to continue to work and serve individuals. It's been stressful, I think, on our staff, on leadership, and so we brought in Mike and Lisa Jacob to talk to us about taking care of ourselves. I think that was important.
It was. For those of you who don't know, Lisa Jacob starred as the oldest daughter in Mrs. Doubtfire. From maybe some of you don't remember the movie Mrs. Doubtfire, but that was the role she played. And she taught us some mindful techniques right in the middle of the conference, and I'm still using one of those today on a daily basis. It only takes a few minutes, helps clears your mind. And gets you reset. And then she helped teach yoga every morning. So I didn't participate because I was out running, but I heard that the yoga classes went really well.
Yeah, it's not something that I've actually had one other time, but did it that morning, and I remember the first time I did, it was very stressful, and I was just pouring the sweat. It was a lot of work, but the way she did it was actually very relaxing, and my back always usually gives me a problems. But that whole day, it was very felt great. We had another gentleman that came and spoke to us, and on the substance abuse side, said that he's former law enforcement, DEA, and he said that he's been practicing yoga for a number of years for his back, and I can see how that it will be beneficial. I need to make it a practice in my own life now, but it was really good. We had about 25 people that actually participated that morning, got up at 7 a.m. to go and be with her and do yoga, and we didn't know if we'd have one or what, but we were very, very pleased with the participation there.
You mentioned a former DEA agent. I found his session fascinating. He got into drug trends, and it just blows my mind the things that people do. And he mentioned that there's a new drug, I think it's called ISO, that's even more dangerous than fentanyl, if you can even imagine. And I don't think we've seen that yet in West Virginia, but more than likely it's coming. So it's just something else we need to be prepared for. The other thing I found interesting is his belief, based on his years of experience and things he's hearing, is that the Mexican cartel is trying to build up meth to the point where they can run the Colombians completely out of the country with their cocaine. So it's a sad state of affairs, but I'm definitely glad that we're able to help individuals both on the prevention side and on the treatment side. But it was very to me, it was very fascinating hearing
fascinating.
what's going on. Yeah.
Yeah, he came and spoke to our substance abuse committee and had us all mesmerized. I mean, here's a guy that worked undercover for the DEA and infiltrated biker gangs out in California, and then he went actually to Thailand and worked there undercover, and so he knows where this stuff is manufactured and the routes that it takes to get here to us in West Virginia.
Yeah. And some of the stories, I think he told us that he bought drugs off of a PTA president,
right,
and a pastor as well.
Yeah,
it's just crazy.
He said you wouldn't know.
Yeah.
You wouldn't know the people that are involved in it, and so he's part of he was part of stopping the sort of supply side, and now he's in since he's retired from that, now he's educating people on the latest trends across the country.
Yeah. So something else that was really exciting for me with this conference was all of our discussion on CCBHC. Mm-hmm. We've heard the benefits from the executive director of the Missouri Mental Health Association. We've heard from the state themselves with the plans on how they're planning on rolling out CCBHC. We also got to listen to a couple of different speakers from the National Council for Mental Wellbeing, which the association is a part of. So a lot of that CCBHC discussion has come from the advocacy work that we've done and getting that bill passed this last legislative session. So I don't know if you want to speak a little bit about the work that we did with that bill.
Well, we've been working on, in partnership with the National Council for what was formerly Behavioral Health and now is Mental Wellbeing, and they created this model for certified community behavioral health clinics across the United States. They passed this bill, I think it was in 2014, and it was called the Excellence in Mental Health Act. And what it did was it created 8 pilot states to take a look at this model and see if they can demonstrate any efficacy in that model. Mm-hmm. And what they found was it's been really successful. And one of those states, Missouri, was one of the original states, and a good friend of mine, Brent McGinty, he does what I do for the state of Missouri, was able to come and talk to us about that. What we did in West Virginia through your leadership as the chair of the legislative committee, we worked with Senator Ryan Weld from the Northern Panhandle and many others to create this bipartisan piece of legislation that basically says to the state of West Virginia, we need to offer a Medicaid state plan amendment to make certified community behavioral health clinics in West Virginia a permanent reality. As you know, Westbrook is a federal grantee, so you guys have received federal grants along with several of our other members, but that money is going to run out at some point, and so we need to have a way to make that permanent. What CCBHC does, it puts us on a sort of a level playing field with other healthcare entities that have a little bit of different way that they fund those services. Right now we're based on a fee-for-service basis. So what we think that CCBHC does is it sort of is morally incentivizes the right services for individuals and not just what the most lucrative services are.
Exactly.
And what we think too is it's going to improve our workforce, it's going to improve the number of evidence-based programs that we're able to offer statewide, and it's going to really mean a lot to those people that we serve.
Yeah, probably the most exciting part for me is the increase in availability of services in rural areas. Mm-hmm. With the 8 counties that we serve, Wood County is one of the more populated counties in the state, but the surrounding counties aren't so much. And it's hard to have qualified clinicians available in all those counties when you just don't have funds to support them. And so this would create stability with that, and it gives the individuals in those counties access to services they might not normally have. So that's real exciting. Creates a lot of stability for behavioral health in West Virginia, which everybody knows there's a lot of behavioral health issues these days, and it's becoming more prevalent. And I think maybe not more prevalent, it's probably not the word, maybe more awareness. People are more willing to get help. So it's a great time for us to be able to build up our professional staff to be able to accommodate that. That with 988 coming into play, it's going to be more readily available for people to seek services. So I think the timing is right for us to be prepared to meet the call, so to speak, with people in need. So it's real exciting.
It's very exciting.
Go ahead.
I was going to say this.
Yeah.
You know, we're really proud of the partnership that we have with the state, and been very excited to see the leadership that they've taken. You know, the Justice Administration, Secretary Crouch, Commissioner Bean, and Commissioner Mullins, and all those individuals that have been very invested in making this a reality. So what we like to think is that, you know, we've got the executive branch on board and we got the legislative branch on board. And so when you have both of those guys working in tandem saying, look, we need to make certified community behavioral health clinics a reality. Passed you know, the legislature, 134 to nothing.
Yeah.
So, you know, that's a statement in itself. So we're pretty excited. You know, you and I were on a meeting yesterday,
Right.
2 hours, and we're meeting every 2 weeks for 2 hours, you know, going through it methodically to make sure that we get it right. We heard from, Cynthia Parsons with Medicaid yesterday that they're looking at different models and actually taking a look at Oklahoma, and so
Right.
maybe even folks from Medicaid are going to go to Oklahoma and see how they've made it work. And that's something that's not a state that we're that familiar with, because we've kind of focused on some of those original states in Missouri, so it's something we need to go look at too. So, but I'm glad that they have sort of owned it, and so they're running with it. That's pretty exciting to see.
One of the things I did hear or read about Oklahoma, one of their CCBHCs was able to provide law enforcement with iPads.
Oh, wow.
And what the use was when law enforcement was dealing with an individual in the community and they thought maybe the individual was experiencing some mental illness, they would be able to use that iPad to link up with a professional to do an evaluation on the spot, and then that would help guide them. Is this person really a threat? Are they committing a crime, or is there a behavioral health issue that needs addressed? And it helped link the services right away. So that was something that they were doing in Oklahoma.
Well, you know, and I've told you before, but my brother has been in law enforcement for more than 20 years, probably 25 years by now, and I know when he got into it, he thought, look, I'm going to be dealing with murderers and bank robbers and rapists, and
Right.
and what he finds is that that a lot of times they're dealing with individuals with mental health conditions, domestic violence, and substance abuse. So what I think CCBHC has demonstrated in other states, I know Missouri, 72,000 referrals from law enforcement. And that way it creates a partnership between law enforcement and behavioral health where they can work together to sort of get people to the right place where they need to be.
Yeah, we've been trying several years here with our engagement with law enforcement. I think we've built up some good relationships, but there's still more work to be done for sure.
Right.
So it's real exciting. But yeah, so the meetings we're having every 2 weeks to set CCBHC up in West Virginia, it's pretty detailed and pretty lengthy, and it's not, CCBHC is not going to be for everybody.
Right.
There's a lot involved. There's a lot of requirements. There's a lot of services you have to be able to provide. There are some services, if you can't provide them, you can contract with another entity. But it is very exciting that this is going to be in place, and that there's going to be centers throughout the state that will, in essence, be coordinating comprehensive care for individuals in need. So it's real exciting. So that was our big accomplishments from the 2022 legislative session. We got 2023 coming up.
Right.
And I know it's only May, but as we knew from last year, you start early. I think we started the bill process for CCBHC around this time, and it didn't get approved until the last day of session.
The last day.
So
squeaked across.
Definitely. So what are some of the items that we're working on for this legislative session?
Well, one thing is, we worked really hard last year on mental hygiene reform. So anytime you make changes to that, you get some consensus, but there are some hiccups there. So we've got some fixes to do on mental hygiene. So we got that work to do. But like I said earlier, many of our members provide services to individuals with intellectual disability. And the one thing about those services and being residential and being 24/7 services, it's very staff heavy. And as you know, we're in the midst of a workforce crisis like we've never seen. I mean, we have seen it for the last 5 years coming down the pike. Now other people in other industries are seeing it. So we've got to find a way to get a qualified workforce ready and able to serve individuals with intellectual disabilities. I'm in this business because someone with an intellectual disability early in my life touched me and directed me in this way. And so, I know that a lot of us have a passion for individuals with disabilities, making sure that they have the best life and best quality of life, which means the best staff available. And so I think what we're going to have to work on are rates for those types of services. We're in a good position right now as a state financially. We've got a lot of resources, but it's time to really take a hard look at what we're paying our direct care workers in the IDD space in West Virginia. So I think that's going to be a top focus for us.
Yeah, really that problem started when the state increased minimum wage.
That's right.
And I know on surface, bumping minimum wage up sounds great. It gets more money in people's pockets, but there's side effects to that some people may not understand. We're not McDonald's where if you bump up minimum wage and the expenses start exceeding the revenue, then we can just change the cost on our menu to capture that and cover the expenses. Our revenues are pretty set, being mostly Medicaid funded, and the rates are set by the state. So if there's not a corresponding rate increase, then what we've done is we've increased our expenses, and we're trying to cover those costs with the same revenue. And so that's when you mentioned 5 years ago, we've been fighting this. We've really been fighting it ever since the state minimum wage went up. Unfortunately, Westbrook's probably in one of the worst positions in the state for whatever reason. We're struggling to recruit workers. We have a 70-75% vacancy rate in our IDD group homes. Our managers are covering shifts, overtime. A lot of staff are working a lot of overtime. We're working on adjusting our wages, our rates to try to increase, not only retain our staff, but to try to encourage more applicants. But we're getting to the point to where we're going to be operating that program at a loss, and we're going to have to use profit margins from other service lines to cover the deficit. If you were in the business world, that's not how you would operate. If you have a line that's losing money, then you more likely would drop that line and then put more resources into the line that's making money. Mm-hmm. But that's not how we want to do things. We want to serve everybody. We don't want to drop the line of business because it's losing money. So I think that's why, as you mentioned, it's important for us to get the word out that we need to help these employees. It's always been my belief that the work those employees do is extremely important to the community and should be more of a career path versus an entry wage path. Mm-hmm. We're taking care of individuals that can't take care of themselves. That requires a skilled workforce, a passionate workforce that really wants to make this their life mission. And if we're not able to pay them to make it their life mission, then you just have constant turnover, which isn't fair to the clients. It's not fair to a client to get used to an individual taking care of them, and then it's switching on them all the time.
Right.
So,
well, you mentioned a lot of things there, and we raised the minimum wage in West Virginia 20%. I think since we've done that, and it's been a number of years ago, probably more like 7 years ago now. We've probably raised the rates for IDD services 5 or 10%. So that doesn't even account for the annual inflation, which before recent times was 1 or 2% a year. So you got 1 or 2% a year, but now we're in this situation where we've got hyperinflation. So we're looking at 8 to 10% inflation just over the last couple of years. So we're in a position where we've got to get people really to the table there and really look at it. We started off tracking, the association's workforce about 10 years ago. And 10 years ago, we had about over 14,000 employees as an association across West Virginia. Last year, we did a May study, and we were down to 7,700 staff. And there's a number of reasons for that, but one of them is this workforce crisis that we're in. Some people say, well, what do you think what's the issue? And part of the issue is generational. If you look at the number of baby boomers, they're a large generation, and those baby boomers are starting to retire and they're leaving the workforce. And now we've got Generation X, which is it's a smaller population. Boomers decide to have less kids, and so that's shown within the workforce where we don't have enough workers to fill some of those spots. And so we've got to figure a way to get people into it. We're doing podcasts like this as an association to recruit people to come and become direct care workers, because it's not a dead end job. It's an entry level job, and that's what people need to look at it. I can work for Westbrook in direct care and residential. I can work my way up into different positions. The president of our association right now, as you know, Dr. Jimmy Byrne, who's the CEO of Autism Services Center in Huntington, started off his career as a direct care worker. And so we need to get people thinking in that fashion. We need to be able to reimburse them and adequately so that we can get the right people in those positions.
Yeah, definitely. We need to get more people in West Virginia too.
You're exactly right. We need people to come here.
I was tempted. I've told some staff this at work. When the governor of Texas was shipping busfuls of immigrants to Washington, D.C., I was thinking maybe I should call him and have him ship a bus full to West Virginia, and so we can recruit. I don't know how that would work, and of course we would want those that have passed the legal process, but I think there's an opportunity here.
Well, we have an HR committee with the association, which I'm pretty actively involved in. It's a tough position. They're trying to recruit. And when the war in the Ukraine broke out, we reached out to a company that's actually placing Ukrainian immigrants. A lot of them live in the United States now. They're on work visas or student visas, but they can't go home, and so they're placing them in positions. So we haven't been successful there, but we've got a few profiles of individuals, and that's we're looking outside of what traditional avenues for getting people. And one could be that type of immigration.
Yeah. So what else do we have on the legislative agenda? I think we've talked about Chapter 20 boards and some of the issues we have with the speed of processing licensure. We run into this situation when we hire a therapist who's been licensed in Ohio, as an example, and we're trying to get the licensing board to flip that to West Virginia. Sometimes it takes forever, and so we're paying staff that can't bill yet. Happens with physicians as well. So I think before we go the legislative route, it's on our agenda that we want to just meet with them and have some conversations. The recent reciprocity bill with Ohio and other states, that's going to be pretty exciting for therapy. But
yeah, there was I think there's a counseling compact bill that provides licensure reciprocity for the number of states that are participating in the compact. And I know the individuals that sponsored that bill, and I think it could be helpful for us. The thing of it, in today's day and age, we shouldn't have to wait, and we can't afford to wait to get people approved through licensure to be ready to work. Right. If they've got the license, then we need to make that happen instantaneously. We've had a problem over a number of years getting background checks and different things, and then you lose folks. They don't have time in this day and age to wait around, and you as an employer don't have time to have them hanging out for 6 months or 3 months for a job. When you offer them the job, you want to be able to start working today.
Right.
And so we've got to make that happen.
Definitely. So another big thing that pulls on a lot of heartstrings of people is children. The number of children going into foster care, number of children going out of state for services is increasing. We are really taking a stance in the state to try to keep everybody in state for services. So that's another big agenda item for us this legislative session.
Well, the drug epidemic has certainly, exacerbated the problem with kids in state custody and foster care, and a lot of times some of those things break down. I've got a meeting upcoming in August with the Hospital Association looking at kids that have been placed in emergency rooms and maybe have stayed there for one case over 170 days.
That's awful.
So that's to me that's abuse.
Yeah, no kidding.
We've got to do a better job, and we've worked really hard over the last 20 years of recruiting foster to adopt parents, and so we've done that, and when you've only got a million and 1.8 million people in the state, you don't have that great of a pool. And since we have done a lot of work recruiting foster parents, I think you keep taking them offline, and so we've got to find a way to better serve kids and families before the breakup happens. And I think we've actually back to our conference a few years ago, we started bringing those evidence-based practices on how to work with children and their families before it gets to a crisis level. So we think that CCBHC too is going to bring a lot of children's services. Yeah. It's proven in other states to increase services to kids for behavioral health by tenfold.
Right, and that's one of the foundations for the services in CCBHC is providing evidence-based practices, which, as you know, that they've been tried and true and tested, and so that's been great. So I don't know if you've seen this or not, but I looked at it briefly and I don't remember the numbers, but DHR recently put out a dashboard that shows the number of kids that's in their custody, and it's just astonishing how many kids we have in the state of West Virginia that's under the custody of DHR.
Yeah, and I'm hoping that there's ways, and maybe even through CCBHC, that we can divert families from having to lose custody of their kids or having to give custody of the kids to the state of West Virginia to raise. The state's not a good parent, and because the state's not supposed to be the parent. The parent's supposed to be it. So we need to provide supports and resources so that people can be the best parents that they can be. Because right now, frankly, it's a strain on the rest of the state of West Virginia. We have great foster parents that have dedicated, their time and efforts, but that's a strain, and we need parents to be able to work with and raise their own kids and families, and I think we can provide some supports to help them with that.
Yeah, not only for getting services for the kids, but parenting classes and giving parents tools and let them get some skills that help them address children with behaviors, because unfortunately we know it's only going to get worse, that we're starting to see kids in early elementary schools that their brain development was affected due to mothers using substances during their birth. So it's getting more complicated. So we're hopeful that we're able to gear up our services to help assist with that, definitely. So Mark, I guess the last thing I wanted to ask you about was your grant that the association has received to hire a couple of therapists so that you can then use those therapists to assist providers throughout the state.
Yeah, we had a creative idea, and that is to, as an association, to hire licensed counselors and social workers to work for the association, but see clients using telehealth at some of our members' locations. So if it would, in one of those areas is Westbrook, we were able to get grants from folks that supported this area, and so we're trying to hire a licensed independent clinical social worker. Right now we've got somebody part-time that we're getting ready to bring on board, and so we're dealing with that workforce crisis as well. So we were not able to get someone with the highest licensure, even though we were offering pretty significant salary for that. So we're going to go back and try to get some graduate social workers and some LPCs to come and work for us. And then they'll have a caseload where they might see people in the Eastern Panhandle, but they'll be sitting in Charleston. And one of the things about some of the different areas of the state, especially the Eastern Panhandle, is they're kind of hung out over Virginia and Maryland, and they've really become a bedroom community for DC. Is that it's really hard to compete with those other states. So if we can hire somebody in Charleston and then they can see clients there, we think that's going to be successful. It started because we had out-of-state entities trying to come into West Virginia and offer telehealth services from, California and Florida and different places. And, folks, they don't know how we are here in West Virginia. We want to see people that know us, and we always talking about cultural competence. When from the federal government, but what that means to me is you got to have people that know West Virginia, can speak our language, and know the issues that we deal with on a daily basis. So we want to get people from West Virginia serving West Virginians.
Right. And the other important thing is you want people living in West Virginia to reap the benefits of providing services, along with the individuals reaping the benefits of the services received. So.
Right.
Yeah. Well, Mark, has been great. I'm glad you came down today.
Thanks for having me.
Absolutely. And we'll do it again sometime.
Let's do it again.
All right.
Thanks.